Hi, I'm Dr. Gary Motykie, and I'm a board-certified Beverly Hills plastic surgeon. And today we're going to be talking about the effects of smoking cigarettes on beauty. I think a lot of people are aware, the news is out there, right? Smoking has some bad effects on your beauty. And we're going to go through some of those changes today. I think in a nutshell, it's basically, in my mind, sort of like premature aging. So we're seeing the effects from inflammation or inflammaging in the body, and the biggest organ in the body is the skin, so it's going to be one of the first places we're going to see the signs or effects of smoking. So if we just take an overall view of it, I think some of the short-term effects or long-term effects are going to be from the smoke itself, right? We're going to see yellowing of the teeth, we're going to see yellowing of the nails, we're going to see skin discoloration, we're going to see things going on just in general from the smoking itself. Then some of the more long-term effects, and I think what people should realize that in the cigarettes, that nicotine, what it does is cause vasoconstriction, or causes blood vessels to tighten up and shrink. That's why it leads to hypertension or high blood pressure and other medical conditions. But in addition, you're constricting the blood flow to the skin, to other organs. So what's happening is the skin's not getting all the nutrition it needs. It's not getting the blood flow it needs to stay healthy and vibrant and glowing. So we start to see dryness of the skin. We start to see thinning of the skin. That leads to wrinkles, fine lines. Also the inability of the skin to heal itself and protect itself. So that's why you start to see sun damage, mottling of the skin, discoloration of the skin, or graying of the skin, because again, it doesn't have that healthy blood flow. So all those effects start to add up, and people start to look older. There's a lot of photos out there of identical twins where one smoked and one didn't smoke. And if you look at that picture again, you're going to see all those signs. One twin's going to look much older because of that thinning of the skin and that causing the lines, the wrinkling, the discoloration. And when the skin becomes weaker, you start to see bags under the eyes, you see sagging the jawline. So overall, the effects are that the one twin that's smoking is going to look much older than the other twin. So one celebrity that's well known to be a smoker is Lindsay Lohan. And I'm not picking on Lindsay Lohan, so we're just talking about some of the effects of smoking. Now, Lindsay also is kind of, I think, known to have some other substance abuse problems like alcohol or drug abuse. I'm not saying she did or didn't, I'm just saying it's out there in the media.
She's been arrested for it.
So, it's probably true. But so all of those things can have effect, right, on the body and the skin. And we've talked about alcohol previously and what it can do. But in her case, she was known to smoke, I think, something like 2 packs a day. And that, of course, is going to start to have effects, like we said, on premature aging. Now, in her, even early on, when she, as you mentioned, when she got arrested, she was only 24 years old, but you could already start to see the effects of the drug abuse, the alcohol, the changes in her face. You start to see bloating, you see the skin changes. It wasn't not only taking a toll on her personal life, it was taking a toll on her face. And then the next thing we saw, there was a famous picture, I think, when she was 24, 25, where she's smiling, and we see the effects of smoking on her teeth and the yellowing of the teeth. And again, that's a dead giveaway, probably from smoking. And then again, we saw the changes just in her face, pretty dramatic for being that young. She was 25 going on 40. And again, I'm not picking on her, but you could definitely see those changes. And that, again, maybe not only from smoking, but the teeth and things like that are. And then all of those kind of substance abuse problems added up to really prematurely age her.
Yeah.
Can you cut that? One of the things that Lindsay Lohan is lucky is she was somewhat successful. She has money, and she was able to start reversing some of those signs. So then we saw when she was 25 that she went and fixed her teeth. She went and probably got veneers and fixed the damage that was done to the teeth. So again, immediately it brightened her up a little bit, made her look younger. So then we see her doing other things to reverse the other signs of aging. That would include most likely things like skin care, treatment of the skin, like microneedling, whether it be lasers, photofacials, then also adding fillers to add a little volume back to the face. So we see the cheeks getting a little filler, the lips getting fuller. One of the things with smoking, you start to see lines and wrinkles around the lips, and filling them up will mask some of that. So you can see that her face starts to change, and some of that may be her trying to reverse some of those effects of the substance abuse and the smoking. So then over the next several years, Lindsay was kind of in that sort of touch-up, doing things to reverse these changes for several years, maybe 5, 6, 7 years. You could see different photos of her where she looked more poofy, less poofy. Just doing these changes we're talking about, adding fillers, changing her styling, trying to mask some of the damage that was done as well as reverse some of that damage that was done. And I think there are times where we see her, maybe it was slightly unnatural or slightly overdone where she looks a little too poofy. And now she's kind of settled into where she's at now. And I think if she continues, I don't know if she's continuing to smoke. We don't, I don't know if is she? I don't know.
Yeah, she still smokes.
So if she's continuing to smoke, then she's going to continue to try and reverse and battle these changes. So we're going to probably see a lot of fluctuations in her appearance. If she's continuing down that road to reverse them, we're going to see again more of these same things, whether it be early mini facelifts, whether it be fillers, whether it be skin treatments, lasers, peels. We're going to see a lot of that going on as she gets a little bit older. So it'll be interesting to see as that changes, what is she going to do to reverse the signs of damage that has been done by the smoking. The reason I mentioned Lindsay and some of the things she's doing to reverse those changes, there is some good news. There are some things after people quit smoking that they can do to start reversing the changes or the damage they've done. And Lindsay's done some of those things, right? So if people are smoking and they damage their teeth or yellowing the teeth, they can whiten the teeth, they can get veneers, they can do some things to reverse that damage. And then also once people quit smoking, the body is amazing. It starts to heal things. Over several years, it'll start to reverse the lung damage. It'll start to reverse the skin damage. The body will start to heal and some of that damage will go away with time if people quit smoking. And then secondly, some of the other things are changes in skincare, things that we can do like Lindsay might have done, microneedling, lasering, Botox, things to help rejuvenate the skin. I think as people get a little older, there'll be like things, if they cause so much damage that they're getting loose skin, mini facelifts or facelifts and fat grafting, and things to help bring vascularity into the face and reverse some of those signs of sagging skin from the smoking. The other things are changing the lifestyle, right? So detox, nutrition, exercise, all these things start to add up to get the body healthier, i.e. the skin healthier, looking younger again. So if people decide to quit, the good news is you can reverse a lot of these changes. And then one little caveat I think I'd like to mention is, because I'm somewhat a believer in it, is stem cells. So when we inject stem cells, one of the first places they're going to go in the body is the lungs. So and all over the body, wherever there's inflammation, damage, that needs to be healing. But in this particular case, I think there is some argument for the stem cells because, again, the first place they're going to go is repair a lot of that damage that was done to the lungs. So it's just something that people should think about or look into, but I think there are some definite positive effects there by injection of stem cells.
You just obviously mentioned stem cells.
Well, one last thing on that, yeah. Well, yeah, because I'm not saying to say, everybody run out and do stem cells if you smoke, but I just, if you can envision, so when you inject the stem cells into a vein, the first place the blood goes to get filtered is the lungs. So think of the lungs of like a sponge or a big filter. So when those stem cells get injected, they're going to go immediately to the lungs and get trapped there, right? A lot of them. And so in this case, that's exactly where we want them to repair some of that damage. So that's why I think in this case, it might be a very interesting treatment for people, particularly if they have a lot of inflammation and damage in the lungs, to reduce the overall inflammation, toxic load in the body.
Which it's pretty, I think one can assume she does have damage to her lungs since she smoked since she was at least 18 and now she's in her mid to late 40s or 30s.
Right.
My only question with regard to stem cells is, would that also have an effect on her appearance, or would it only heal her from the inside?
Well, there's a lot of controversy about that, right? I think stem cells by themselves need a stimulus, so I think the effects will overall help with inflammation everywhere in the body. So once the body's healthier, like I said, the nutrition, the blood flow, that's going to start getting to heal other things, just so the beauty, the appearance, hair, skin, everything, and then stimulating that area. So doing things like, if you're going to inject the stem cells, cause some microinflammation, do microneedling, do things where the stem cells will be attracted to that area as well, will help heal that area and bring in new blood flow, because stem cells also help create new blood vessels and heal things. So I do think overall there should be a general overall improvement in the appearance and maybe younger looking, and then you can do these things to help stimulate those stem cells. And then, like I said, decreasing the overall just inflammation level in the body, because that's really, again, inflammation and causing, inflammation causing aging.
What you just spoke about with the treatment to the face, we call that stellar skin in this office.
Yeah, so yeah, like a stellar skin treatment is where you're creating micro injuries, whether it be with microneedling or stamping, and then injecting the stem cells at the same time, so you're activating them in that area. So, if it's in the face and you're doing stellar skin treatment, you're going to inject those stem cells, but also cause little micro injuries so that it activates those stem cells to start healing and rejuvenating the skin.
And just to clarify, because I know I'll put photos up here, the photos aren't necessarily, I don't think they are, of patients that have been smokers, but those type of treatments are good for any type of rejuvenative surgery, right? Not just for prior cigarette smokers.
The stem cells?
Yeah.
Yeah, I mean, it's just for general aging, overall improvement of appearance of the face. Acne, again, huge inflammation of the face, scarring in the face. Those sorts of treatments can help heal the skin and reverse all the scarring changes and the changes that come along with aging.
Yay! Get sober, Lindsay Lohan.